Welcome to Hormone Harmony with Dr. Anna. I'm Dr. Anna Garrett, and I am a hormone expert, and I specialize in working with women who are in perimenopause with a variety of hormone testing and balancing services, which you can find out more about at www.drannagarrett.com. And I am here today with my friend, Dr. Betsy Hoyda. And the reason we are here together, because I normally do these on my own, is because I keep hearing from women that their doctors are telling them that compounded hormones are not safe, not FDA approved, therefore they should not be used. But I feel that this does women a great disservice by cutting off therapeutic options that could potentially be beneficial because they're so customizable. And I'm not a compounding specialist. I have never worked in a compounding pharmacy. I know just enough to be dangerous. So I invited Betsy to come on with me today so that we could talk about what they are, how to use them, what the pros and cons are, and just basically set the record straight for you. So welcome, Betsy.
Thank you. So I'm Dr. Betsy Hoyda, and I have worn many hats in the pharmacy world, but my favorite has been the past 2 years I've worked in a compounding pharmacy. And I went on to receive further training this past summer in hormone replacement therapy as a specialist with the Professional Compounding Centers of America. So I became legit.
You are so legit.
So legit, too legit to quit.
That's right. So let's just start out by talking about what bioidentical hormones are. So ladies in the world, there are bioidentical hormones, which are the exact compounds that your body makes. So when you are still in your hormone youth, you are making estradiol, you are making progesterone, you are making testosterone, and bioidentical hormones are what is used to replace those compounds once your hormone levels start to decline in perimenopause and menopause. On the other side of that equation, we have synthetic hormones, and synthetics are very similar in chemical composition to the bioidenticals, but they have like one minor chemical modification that makes them patentable by drug companies so that they can be sold to make big bucks. So
Exactly.
Any compound that your body makes cannot be patented and sold. So there are a couple of exceptions to that, and we'll get into that, but just know that synthetics are made by drug companies, sold for profit, and don't necessarily have the same side effect profile that bioidenticals do. And if you look at risk, because that's something that comes up really often when you talk about hormone replacement, the risks can be similar for some and different. So we'll get into some of that as well. So Betsy, can you tell us a little bit about, we know that bioidenticals are customizable, about the dosage forms that are available?
Yeah, I mean, they're kind of limitless. So we can go orally, and we can do tablets, we can do troches, we can do, those are the two biggest, tablets, troches, and
Creams.
then then we can do topical. So we can do creams, we can do gels, we can do transdermal patches, which is actually, that's a synthetic or, produced by a drug company. And I wanted to expand on how you talked about that, the synthetic versus bioidentical. There actually are drugs that are synthetic that are made up the same thing as the compounded ones. So they contain the exact same thing. It's just one's produced by mass market and then the other is compounded. Does that make sense?
Yeah. So our body, for instance, with progesterone, let's break it down into the different hormones and go through those.
Yeah, good.
And what we didn't touch on with the dosage forms is pellets, because that's something that some people use. Those also are made in a compounding pharmacy, and they're like little grains of rice. And basically your doctor makes an incision in your butt and sticks the pellet in and puts a stitch in there, and that pellet stays in there for 3 to 4 months, depending on how quickly your body is using the hormones. My personal opinion about pellets is that it is not the place to start with hormone replacement therapy, because if you get the dose wrong, you are stuck with that pellet for 3 to 4 months.
Yes, you are. Absolutely. Absolutely. And they lose their potency after a while, but you're stuck. Exactly. Like it's in there.
So you're sort of getting this big bump in your hormones right when you have it inserted, and then it comes.
Exactly.
And there are some people that love them, and I think they're fine if you know what your established dose of hormone is, and you can be pretty sure that it's going to be right. So
I agree with you. And some people don't like they don't want to take something every day. Right. They don't want to use a cream or whatever. It's again, so customizable and so individualized. It just, women don't fit into a little box. And that's the beauty of compounding. So.
Well, and one thing we didn't talk about at the very beginning, and maybe we can touch on this, is compounding thyroid medications, because you talk about customizable.
Yes.
It opens up a whole world of thyroid replacement dosing. And that's not really what we're focusing on today.
No, but it's a good side note.
Yeah.
To realize, yeah.
So if you're watching this and you're having trouble getting your thyroid hormones regulated with the commercially available products, then a compounded product may be something that you want to ask your doctor about, or email me and we can talk about that.
Absolutely. Just to add to that, I told you that I love compounding. I had a patient once who wanted to know what was in the commercially available versus the compounded. And so I showed her exactly what we used. Our product was so much cleaner. It had 3 ingredients as opposed to 10 for the compounded. And the beauty with thyroid is, again, it's not a one-size-fits-all approach. So we can do any dose.
Yeah,
exactly. A compounding pharmacy can do any dose. So
let's talk about sex hormones, and let's start with progesterone.
Sure.
So bioidentical progesterone is made from diosgenin, diosgenin, which is a compound that's found in wild yams. And the body cannot do the conversion of the diosgenin to progesterone by itself. So that compound is converted in a lab to progesterone. That does not make it unnatural. It just means that conversion can't be done in a lab. So it is chemically identical to the compound that your body makes. So Betsy, what is out there dosage form wise for progesterone, and why is it that Prometrium, which is a drug name, but it is bioidentical progesterone, how is it that they were able to patent that one when it is chemically identical to what the body produces?
That's a great question. So let's back up. Prometrium is exactly the same as progesterone, but it's in peanut oil. Not the best choice in my humble opinion, because if you run it, I mean, some people have allergies to nuts, right?
But I bet that's how they got it patented.
Yes. Yes. Boom. Yeah. So, I mean, I don't work in the manufacturing world. I don't know the ins and outs of it, but you're exactly right. And it's covered by insurance. It's yeah. Let's just leave it at that. But I wanted you talked about progesterone. So let's talk about the difference between progesterone and progestin.
Oh yeah, because that's really important to understand.
Yes, and they sound similar, right? I mean, you kind of think pro.
Just.
Right. Well, and actually progesterone is essential for life. I mean, it's the hormone in our body that helps maintain a pregnancy. So quite often if you're struggling with infertility issues, your doctor will give you progesterone suppositories compounded for you, and to maintain that luteal phase. it's the second half of your menstrual cycle, but it's what happens when the egg is fertilized. So yeah, but I got ahead of myself. Sorry. We're talking about progesterone versus progestin.
That's okay. No, it's important for people to understand, when it's produced in the cycle and all of that, and what its job is.
Right. Exactly.
So let's talk a little bit more about what its job is. It's way beyond just maintaining pregnancy. Yeah. It's our calming hormone, so it helps with anxiety and mood swings. It's great for nerve health. It's good for bone health. So this is an important concept to understand, because when we start talking about synthetic progestins, they don't have those benefits. And so that's where some of the big difference comes in.
Wonderful. Yes. And also, you were saying, back up a second, we were talking about the difference between the two, and forms.
The dosage forms. Yeah.
Dosage forms. Yes. I wanted to talk about, the different dosage forms that it comes in. So it comes in a suppository. It comes in a capsule. And when it's delivered orally, it is converted in your body to pregnenolone. So, right?
Yeah, so there are 3 different metabolites, but the allopregnenolone is the one that helps you sleep. And that's why that is better for sleep. Yeah.
This is why I like working with you, because you can finish my sentences. We're like hormones. We work together in harmony, right? I know what I wanted to say. So we're talking about estrogen, progesterone. We haven't really unpacked.
I got to estrogen yet.
Right. But talk about their relationship together.
Yep.
Because you were talking about, the progesterone, how it functions in the body. It also functions as, it protects your uterus. And so you need it in combination with the estrogens, because the two balance each other out.
Yeah, exactly.
Yeah.
And so what happens in perimenopause is your progesterone production falls pretty quickly. And so you're left with all of this estrogen that's running the show. And that's what results in weight gain and mood swings and heavy periods and breast tenderness and all that crap that nobody really wants to deal with.
Exactly.
And that's a lack of progesterone.
Exactly. And your estrogen levels can be low, and you think, okay, but your progesterone is quite often lower. So you have what we call estrogen dominance, which is not good.
And so progesterone cream is something that's really commonly used, mostly because it's available over the counter. And even though that is true, I personally don't feel like hormone replacement therapy is a good do-it-yourself project.
No.
And so I always now recommend that that you work with a trained provider to help guide you, because in some instances, if you use progesterone, especially if your cortisol is low, it can go right into that cortisol production pathway, and you end up feeling a million times worse than you did before you ever did it, before you ever started it. So that's just my word of caution, is be careful if that's a path you want to go down. I
agree wholeheartedly.
So either Betsy or I could guide you in that way. Okay, so progesterone, our feel-good hormone, comes in lots of different dosage forms, helps us sleep if you take it orally, and just is a general all-around good friend to have in perimenopause.
Good friend. I love it.
So let's talk about estrogen, because estrogen is a good friend when they're in the correct amounts, because estrogen dominance is something a lot of women deal with. And in perimenopause, I think we assume that is a period when we have low estrogen, but what is actually happening is your estrogen levels are doing this all through perimenopause. And it's just a roller coaster ride for a lot of women. So as you get through perimenopause, your estrogen levels do drop, and sometimes women need estrogen replacement. So talk a little bit about what the options are there and when you might choose one over the other.
Sure, absolutely. Well, and I wanted to back up a second and say, I feel that estrogen is a little bit scary, right?
Oh, yeah.
But when you really think about it, estrogen is female.
Yeah.
Yeah. And it's healthy and it's good. And so it's just, again, a delicate balance. So to back up and talk about the different forms, again, we can go, there's oral estrogen. There is topical estrogen. There is vaginal estrogen. And again, these all are converted in your body differently and metabolized differently. But I really wanted to talk about vaginal atrophy and itchiness, and how quite often you can use it to relieve that. And it's just a small amount applied, and it will help with that. And that is metabolized to estriol, or it's actually estriol. And so it's just a really, really safe, non-invasive way to deal with vaginal atrophy, which a lot of women deal with.
Well, and it actually fixes the underlying problem. So it's not like you're just slapping a Band-Aid on something. It causes the vaginal tissue to actually plump back up.
Yes.
And truly solves the problem.
Yep.
You know, we hear a lot, so we're going to talk about estrogen quite a bit. Let's spend some time on this. So, you know, oral estrogen, I am personally not a fan of. Because it comes with the risk of blood clots, heart attacks, and strokes.
Right.
And all of those things are things that are clot related. And the reason for that is because when estrogen goes through your liver to be metabolized, it affects your clotting factors, which increases that risk of clots. So that, you know, and the same as with birth control pills. It's not just, you know, oral estrogen for menopause. The same risk applies for birth control pills.
Yes, ma'am.
So in my opinion, if you can avoid taking an oral estrogen, and I know there are some insurance companies that is the cheapest option to go with. If you can avoid it, then do. And, you know, I think the topical ways are really the way to go, like the patches. I mean, what could be easier?
Absolutely. I agree.
Change it twice a week and you're done. Well, and it's interesting because I actually have had one client who did not absorb the estrogen from the patch. It was just the weirdest thing.
Really?
She wasn't putting anything on her skin. It just didn't work. Some people have sensitivities to the adhesive, so they may not be good candidates for it. And then there are creams. So those are compounded. So tell us a little bit about how those can be compounded, because there's a million different ways. Yes. They can be compounded by themselves or in combination with other hormones. So I talked about how it's important, if you are on an estrogen, to be on progesterone as well to balance that out. Those two can be combined in a cream. And I did want to say that a lot of practitioners don't do this because it's kind of inconvenient for the woman, but if you really want to do it best, you would try these all out separately, and then kind of find what works for you, and then they can be combined. But that doesn't really happen that much. I know, and it's too bad, because like with testosterone, it's really easy to overdo the dose.
So
and
true.
If you put it all together, then it's like, okay, I just spent however many dollars and I'm now got to go get this thing changed.
Exactly.
And yeah, it's more expensive to do them separately to start with, but you're less likely to waste a prescription if it's
absolutely
wrong.
I agree with you.
What else did I want to say about estrogen? So, let's talk about safety, because this comes up a lot. I mean, it is probably the number one question I hear from the women in my group. And I have a Facebook group called Hormone Harmony Club, if anybody is not already in that. And we're talking about all things perimenopause and menopause related. So, you know, back in 2002, the Women's Health Initiative study got everybody all whooped up, and women got ripped off their estrogen like immediately.
Woo!
And just so you know, we don't go off of estrogen immediately. We taper it because your body becomes very unhappy.
No.
So what did the data actually show in that study?
So I think we need to talk about what drug did they use. They
Right.
used something called Prempro. Prempro is a combination of synthetic estrogens and synthetic progestin.
Ins.
In
Not own, in.
It's a harmony, right? Own in. So we have too much fun. So that was the drug Prempro. It's not on the market anymore. It was yanked off.
It is on the market.
Is it?
At least in Canada it is. I know, because there are women that I see that get put on Prempro, and I'm like, why?
I bet in Canada you can do that.
Okay. Maybe it's the Canadian people.
States. Oh, I don't think so. I mean, I don't work.
Okay, so
We
back
can
to
fact check that. Anyways,
probably ought to fact check a lot of things.
we're destroying our credibility here.
No, we're not. Pay no attention to us, ladies. We're fine.
Having fun. We're having fun. We're having fun. We do take our hormones.
Yes, we do.
Okay, so we were talking about Prempro. We were talking about the Women's Health Initiative, which freaked out a lot of people. It freaked out a lot of people for good reason. So you were talking about the negative effects of estrogen. Well, it can cause breast cancer. It can increase your risk of breast cancer. It can increase your risk of having a stroke, having a heart attack. That's bad. But I feel that it kind of painted hormones in a bad light because people didn't want to be on this stuff. They were afraid of it. But they just neglected to tell you about what drug they really used, right?
Mm-hmm. Exactly. And so the headlines were estrogen causes breast cancer. Well, the truth in that study is the women who were on estrogen alone actually had a small protective effect against breast cancer.
Yes.
And the women who got the combination product, what they figured out was that it was the synthetic progestin that actually was raising the breast cancer risk.
Yes, exactly.
And so so that came out in 2002. And then a couple of years ago, there was a Danish study that looked at low-dose birth control pills and hormone impregnated IUDs. So the Mirena IUD has a synthetic progestin in it, and that's what prevents pregnancy or implantation.
Right.
And that study also showed that there was a small risk of breast cancer with those products. So to me, that was just like solidifying the case that the 2002 study kind of got it all wrong when it came to who was the bad actor in the study.
Truth. Absolutely.
And so that to me is a great reason to not ever use Provera, also known as medroxyprogesterone.
Right, which sounds confusing because it has the progesterone, right?
Right.
But you gotta check your facts with your compounding pharmacist.
Exactly.
Truly. And on that note, find a good compounding pharmacist who will sit down and show you these things and teach you. You want the heart of a teacher, really and truly, because they're there to help you.
Exactly. So let's shift to testosterone, because that's testosterone and DHEA are kind of our last.
They're
our last big gun. So those are the male hormones.
Yeah. Androgens.
A little bit goes a long way in women.
Right.
And so the issue from a compounding standpoint is that there are no commercially available products for women on the market. So if you're on testosterone, it has to either be compounded or you have to inject it. And that, although I had a client the other day that I was talking to who was telling me that she was using the men's testosterone gel and just like putting a little bit of it under her arm. And I was like, you know what you're getting. I know. I was like, okay.
Because once you start that stuff, you don't want to be stopping it, right? So, I mean, unless you're working with somebody who really knows what they're doing, but ooh, boy, that makes me nervous. Anyhow, Yeah, let's talk about DHEA and testosterone.
So
as we age,
our DHEA comes down,
mm-hmm.
and this is a hormone that is androgenic, so it contributes. Well, let's talk about the hormone cascade. I wish I could draw a picture.
Yeah, right.
DHEA is the hormone that turns into either estrogen or testosterone, so it can go either side of that pathway.
Mm-hmm. Yep.
And in women, it tends to go more into the testosterone pathway, and in men, it tends to go more into the estrogen pathway. So it also it helps support your adrenal glands, so it helps with your overall feeling of well-being, as well as being androgenic. And this can be had in capsules over the counter, except in Canada. You don't get any in Canada. And it can come in cream. It comes in vaginal inserts, and it's actually, there's quite a bit of data that supports using it for vaginal dryness now as an alternative to estrogen cream. So.
I saw that. I did learn that. To back up for a second, so the tablets are available over the counter, but the cream is not.
Yeah, but those vaginal inserts are.
That's confusing.
So there you go. In combination with estriol. Yep, on the internet. There you go.
Don't buy things off the internet.
You can have anything off the internet except testosterone. Anything.
You probably could find that too, but
no,
we're
I've
not
never
promoting
found it.
that.
I've looked.
We're not promoting it. We're not promoting it. And please do not purchase stuff without.
Yeah, check with your friendly
pharmacist. Right? Exactly, because we don't mind giving out advice to people who want to learn, but cleaning up messes are not the most favorite thing.
So testosterone is generally compounded into a cream, and women are started at doses of as low as 500 micrograms, and then some people are a little more aggressive. What I have found is that these hormone clinics tend to be really, really aggressive with testosterone.
Why? Because it makes you feel good, right?
Right, exactly.
Who doesn't want to feel like a 25-year-old?
Well, until the hair starts sprouting out of your chin or your face breaks out.
Right. I mean, there's a reason that it's called an androgen, a male hormone.
So hair falling out, yeah, not so good.
Rage!
Right. So that...
We don't need mamas who are raging.
So I want you now to talk about this whole business of doctors who say, oh, it's not FDA regulated, and how do we make women feel comfortable that the products they are getting from a compounding pharmacy are actually safe and effective?
So these pharmacies are regulated by the FDA. We use products that are approved by the FDA. And I think I told you a lot of the products that are approved by the FDA that are considered safe are the same exact ones that we're doing in pharmacy. Ours are safer, in my opinion, because again, it's bioidentical. So, I mean, if you think about it, like fitting like this, they fit better. Wouldn't you want the hormone that fits nicely in here as opposed to something that fits like that? Right? But I mean, there is rigorous inspections that compounding pharmacies have to go through. We are held to the United States Pharmacopoeia, USP. We're held to those standards when we're compounding. So everything, I mean, our pharmacy has not been inspected, but we're open to it, you know, at all times. So we have to be very, very conscientious. And I mean, we're pharmacists.
Right.
We are afraid. We have to find all the facts. And I don't know about you, Anna, but I find so much solace in finding a study, finding the facts, because that's really our livelihood. I mean, our job is to be safety guards for, we deal with medications, which are poison.
Yeah, it's not just to count by fives real fast and put things in bottles.
No, that's not why I went to school.
So can a customer come in and ask about your quality assurance standards? And...
Absolutely. Absolutely. And we are part of Professional Compounding Centers of America, and they will, in a heartbeat, evidence, you want evidence, they will give you more than you even want.
Awesome.
Just saying I sat through hours and hours and hours of evidence.
Of training.
Yes, it was fun. I try to pretend like I didn't like it, but I did.
So is there anything else that you would want to share with somebody who's watching this video as far as hormones go, or just to help them feel confident that they're making the right decision for their health and their body?
Absolutely. I would never, ever recommend anything that I would not do myself. And I because I'm a scientist, I have experimented. I have tried the over-the-counter cream. It's a mess. I was a hot mess, pun intended. But everything that I do, I've seen the evidence. I've researched it. I've read the internet on it, and I would not recommend it if I did not believe in it, if I didn't stand by it.
Well, and I, what I would say is there's no need to suffer. I mean, perimenopause can last 5 to 10 years, and then menopause lasts the rest of your life.
Right. And to expand on that, do you want to talk about menopause is just
one day of your life?
One day, right. Right.
So it's the day that marks a year since your last period. Right. And then everything after that is post-menopause, and it lasts the rest of your life, literally. Because you're never not going to be menopausal. And there are very clear recommendations on how hormone therapy should be used that have been put together by the North American Menopause Society. And I don't always agree with what their position statements are, but on this particular topic, I do. And they changed those recommendations in 2017 to reflect a more modern way of thinking about hormone therapy. So now the guidelines say that if you start it within 5 years of menopause, that it can be continued as long as it needs to, because of the benefits on bone health and cardiovascular health. And there's starting to be a body of data that is coming out about effects on dementia.
Yes.
So it's
very good.
It's super important. And so that's a conversation, to have with your doctor about that. But I think it's really important to learn enough to advocate for yourself in this situation. So if you want to try bioidentical compounded hormones, you've got enough information from this video to be able to arm you to go in and have a conversation about it.
I agree. And if your practitioner is not listening to you, find somebody who does, please. And honestly, Anna, I wanted to say, as a mother, I don't think I would have my girls, my beautiful babies, if I didn't take progesterone. And it sucked. I'm not gonna lie. It was messy, inconvenient, but I wouldn't have my babies.
Right. Exactly. And for women who are past the baby having stage, there's a lot of living left to do after menopause. So
right.
I think
right. We're not dead.
And it's important.
I'm not there yet, but you're not dead.
If you thanks.
You're welcome. You're alive and thriving.
If you want to have the best quality of life, I mean, there are plenty of people who sail through menopause and they don't need anything. Well, mine had a hysterectomy, so she was no help. But there's no need to suffer if you need to go that route. People post in my group all the time, I had to give in and go on hormone replacement.
Right, you're not weak.
Not giving in.
You are not weak.
Right. You are
not at all.
You are taking care of your quality of life, and that's all there is to it.
Absolutely. And I mean, what a testament you talking about this is. It works, and we're two women who believe in it and want to help you.
And it can take some tweaking to get the dose right. It may not be right on the first attempt, but I think this is where testing can really come in to play, is to see how significant your imbalances are, where, you know, how low are your levels, you know, what needs to happen. And I think, you know, to end this without talking about stress management would be a mistake, because because cortisol is going to run the show over all of the other hormones, and that's an entire other webinar.
Exactly. Your insulin, your cortisol,
all of that.
Yep.
That's another day.
Another day, another dollar.
So if you are in perimenopause, or you think you might be in perimenopause, or you're not sure, you can go to my website, and I have a quiz on there that you can take.
Can a pharmacist help you?
Yes, pharmacists can definitely help you. We are the drug experts. We have 6 years of school in nothing but drug therapy, and
sometimes more.
Sometimes more, yeah. But your doctor, unfortunately, does not have the benefit of that much training. And I'll just share a quick study that came out a couple of years ago that AARP did. And they, the title of the article—
What is AARP?
American Association of Retired People.
Huh?
And they went around and surveyed OBGYN residency programs to see how many of them offered hormone training. And what they found was that only 20% of OBGYN training programs, so we think of them as the hormone specialists, right? 20% had any hormone training, and of that 20%, most of it was elective. So they don't get trained. Doctors do not get trained. And so they have to go out and seek this education on their own. And there's really no incentive in the medical system to do that. So I want to end by just saying it is not your doctor's fault, and they are not trying to not help you, because that's not what they're in business to do.
They're doing the best job that they can.
Right. And they don't know. And in a 7-minute office visit,
yes,
nobody's going to be able to sit down and have an hour-long conversation about what is going on with your hormones and your health and what your goals are for yourselves. Yeah. So that's why I think considering other practitioners like a doctor of pharmacy or a naturopath or whoever is a great way to go. And in my book, The Savvy Sister's Guide to Hormone Harmony, which you can get on Amazon, there is a whole chapter on hormone testing and advocating for yourself. And
it's a good book.
Thank you.
A must read. I'm a fan. That's why I found you.
So I hope this video has been informative, and that you feel more confident now in your ability to have a conversation with your healthcare provider about your needs and how you want to experience the perimenopause and menopause transition, because that really is my whole business, is to help you do that in the most positive way possible.
Thrive. You want to thrive. You're alive.
So stay tuned for the next edition of Hormone Harmony with Dr. Anna.
It's fun hanging out with us, right? I just invited myself.
And Betsy, I really appreciate you being here with me today.
It's been fun.
And sharing your expertise on compounding and hormones with everybody. So I appreciate you very much.
I appreciate you too.
So see you next time.